We think we know what a heart attack looks like: crushing chest pain, a sudden collapse, but that picture is dangerously wrong. The alarming truth is that up to 1 in 4 heart attacks are silent, occurring with symptoms so faint they are overlooked. Silent doesn't mean harmless. It means the signs are mistaken for indigestion, the flu, or simple muscle fatigue. But inside, the damage is severe, scarring the heart and dramatically raising your risk of a future, fatal cardiac event. Next, we'll show why these attacks happen, why trusted tests fail, and the new technology that finally sees this invisible threat. So, what are these confusing symptoms we are meant to recognize? They are not what the movies have shown us for decades. It can be an ache in the jaw, neck, back, or arms. It could also present as shortness of breath or sudden profound fatigue. Certain people face a much higher risk of these atypical silent events. This includes women, older adults, and people with diabetes. You might assume a checkup would find it, but a standard EKG can easily miss evidence of a prior silent heart attack. The bigger failure lies with the test seen as the gold standard, the treadmill stress test. It's looking for the wrong problem. So how can test doctors depend on being blind to the plaque that causes the majority of heart attacks? The answer will surprise you. A stress test pushes your heart to demand more blood. It's designed to find obstructive plaque, large blockages that narrow the artery. But that is not how most heart attacks happen. The entire premise contains a fatal flaw that leaves millions of people at risk. The reality is that a large portion of heart attacks are caused by non-obstructive plaque, smaller, softer, volatile deposits. The real danger is not the slow blockage, it's the sudden rupture. This soft plaque bursts, forming an instant clot that stops blood flow. This explains the what, but why are some people more likely to not even feel this catastrophic event as it is happening? For those with diabetes, high blood sugar can damage the very nerves that should signal chest pain, silencing the body's main alarm. Add to this high blood pressure the silent killer itself, which damages arteries for years without any noticeable symptoms. And it is a complete myth that this only affects people who are out of shape. Active individuals can have unstable plaque. This creates the perfect storm: a person who feels fine, passes a stress test, yet is at high risk for a sudden, massive heart attack. If the old diagnostic tools are failing us, what hope is there for genuine early detection? Fortunately, technology has advanced. First, a biological complication. The body sometimes grows tiny new blood vessels, called collaterals, which can mute warning signs. This proves we must stop guessing from symptoms and start looking directly inside the arteries. So, how can we actually do that? The first tool is a coronary artery calcium, or CAC score. This CT scan measures hardened plaque. A high score is a major red flag. The second tool is cardiac CT scan. This is more powerful as it can actually see the scar tissue from a past silent heart attack. The third tool is a high-sensitivity troponin blood test. It detects microscopic heart damage, acting as an early warning system. These are all huge steps forward, but one new technology is changing the entire approach to prevention. Recall that dangerous non-obstructive soft plaque that causes a significant portion of heart attacks? We can now see and measure it. This is achieved with new AI-powered heart CT scans. They measure the amount and, critically, the specific type of plaque. This is the definition of precision medicine. Doctors can identify the highest risk plaque and treat it aggressively before it ruptures. By combining this imaging with our knowledge of at-risk groups like women and diabetics, we move from reacting to actively preventing. So can you have a heart attack without symptoms? Yes. They are common, dangerous, and our trusted tests are flawed to find their cause. The main takeaway is this: your biggest cardiac threat may not be a major blockage, but small, unstable plaque invisible to a stress test. But awareness is protection. Understanding your risk factors, recognizing atypical symptoms, and knowing better tools exist is the first step. Have an honest conversation with your doctor. Discuss your full risk profile and ask if a CAC score or other scan could be right for you.